luck, guys.
There we go.
Are you going to turn your videos off?
Yes, I am.
Hello. I can see lots of people falling into the webinar as we speak. We're at 40 people. 70. I'm not purposefully not starting, guys. I'm just waiting for the room to fill up. Otherwise, some of our guests will end up coming in and I'll be halfway through an introduction. We're expecting a high number for today's session. When the number settles down, I will start. It looks like it's settling down now. Lovely. Okay. Feel free to trickle in as you come in. We've got an introduction before we actually go into the seminar. So hello everyone, it's great to see so many of you here today. I do know that there are some people that couldn't join us. Our very own Robin Townley, the Chief Exec of the ABTT, is on furlough, but he's asked me in his absence to extend to you all a very warm welcome. He offers us his best wishes in the hope that we all take away something stimulating, useful, helpful from this programme of seminars, in addition to the companionship that coming together provides. I'd like to echo what Robin says and now welcome you all on behalf of the ABTT to this seminar session. It's called Mental Health in These Current Times. Before I hand you over to the host, which ironically is me, let me first go through some housekeeping advice on this webinar platform. You might just want to pop up to the right hand side and switch from speaker view to gallery view. This way you'll be able to see all of our panelists on your screen at once. Feel free to use the chat function at the bottom. On this function, we can all see that you can shout out to your fellow attendees, let us know where you're coming from. We've got some international people joining us for seminars today. You can also share your thoughts here. Alicia will be monitoring this section and she's on hand to help. There's also another tab at the bottom for you to interact with, and that's the Q&A tab. In the Q&A tab, that's the one where we would like your questions, please. So don't leave them in the chat, make sure they go into the Q&A section. So you can pose a question to our panel and there'll be various points throughout the panel where we will stop for questions. So feel free to write them down as they come to you, but there will be designated sections where we'll respond to them. We just ask that you're patient with us. There are lots of you in today's session and we will try to get through as many as we can, but it might not be possible to answer them all. I also just wanted to remind the panel and to everybody here that today's session will be recorded and we hope to be able to make this available to you later on and to those that couldn't attend. So I'm now going to take off my introduction hat and become the chairman and the host of this particular seminar. I think you all know my passion for the subject of mental health. It's a subject that's very close to my heart. I just wanted to introduce you to the panel. I'll actually let them introduce themselves. Paul, would you like to go first?
Yeah, hi everyone. Nice to sort of meet you virtually. Obviously I can't see you or anything, so that's a bit strange. But yeah, I'm Paul Hanna. I'm the Research Director for Clinical Psychology at the University of Surrey.
And Alison?
Hi everybody. I think I'm glad that I can't see everybody if there's a fair few hundred of you out there. I'm a mental health first aid instructor and we'll be I think we'll be covering that topic a little bit later on. But I used to work for my sins for BEC2 in the training department. So some of you may well be members of BEC2 as well, of which I am a member in my other life.
Great, okay, so there's a few things that I wanted to share with you and I wanted to stimulate discussion on. It's very rare to get hold of Paul, he's very busy, especially now, in the current climate. So now that I've got Paul with me, Paul worked with me on a project called Blackout and we were very lucky to share that project at Plaza. So Blackout is a 6-minute immersive installation with me trying to explain what it is like to have my condition of bipolar 2. And Paul ran a evaluation alongside that installation. He's done it twice for me now. He's done it once at the Guildford School of Acting when we launched it, and he also did an industry-specific backstage mental health evaluation. It's been a lifelong dream for me to get more information about my own industry and how mental health, how we deal with mental health and how prevalent it is in our industry. And finally, we have some evidence to that account. So Paul's just going to take us through a summary of that evaluation because we've got all of the results for that. And then afterwards, you can ask some questions. So I believe also that Alicia is going to put a link to that particular document in the chat for you.
Yeah, thanks, Mig. Yeah, just to say as well that, you know, obviously the report is publicly available. So if you haven't ever seen it, feel free to have a look. And if you have any questions at a later date, then I'm fairly certain that my email address is in the report somewhere. But if not, you can just Google me and it will come up on the university's website because they like self-promotion quite a lot. So just to cover the evaluation, essentially it was an interesting project for me because I've worked in mental health for years, largely in slightly more clinical settings. So Mig and I knew each other through Blackout, and it was quite a novel opportunity to be doing something very applied with industry partners, so Plaza, ALD, PSA, ASD and ABTT all funded this project. I've got them all right, I think, Mig. All funded this project for me to undertake a piece of work. And I suppose that part of the reason for that was there was some, from what they told me, some anecdotal evidence that, you know, mental health was a bit of an issue in the industry, possibly because of the, you know, the working patterns, those sorts of things. So they commissioned me to have a look into that. So to give you a general thing over to start this off, it's estimated that at least 1 in 4 people will experience a diagnosable mental health issue at some point in their life. Not often will they be diagnosed necessarily, but that's sort of a bare minimum estimation. I would say from nearly 15 years of experience working in the field, I would probably at least double that, to be perfectly honest, if not go quite a lot higher. I suppose a lot of interest comes with the current government around money. So just to give you a bit of an estimation on the impact of mental health on industry, roughly last year it was roughly there was roughly £35 billion lost in terms of productivity, absence from work and staff turnover as a result of mental health. And it's estimated that when you then look at mental health treatment paths, etc., it's around 105 billion pounds to the economy. So it's quite a big sort of financial incentive. Anyway, getting back to the evaluation, so that gives you some context of the extent of the sort of issues we're dealing with. The evaluation was commissioned by the 5 industry partners, and they really wanted me to sort of appraise the situation, really. What is the mental health prevalence like in the industry, and what kind of patterns are there to that prevalence? So we had a roundtable meeting just under a year ago. I think it was in September in London, where all 5 partners got together to try to thrash out some of their ideas as to what they wanted in this evaluation. I then sort of took those ideas, had a bit of a screaming fit at the fact there were so many different ideas and we couldn't possibly solve the world overnight, but took those ideas and managed to formulate some agreeable questions. They were then sent out via a range of different ways through all of the trade associations, but also online via Twitter, all targeting people working within the industry from a range of different areas. We got 1,302 responses in the end, which, you know, from my perspective is a very good number for a very quick survey that was only open from middle of September to middle of October. So we did pretty well. Of that number, the majority of our sample were male. 72.6% were males, with 26.7% female. Again, in terms of where they were working, there was people in lighting, was sort of the highest number. 332 people classified that they worked in lighting. Sound and audio was the second most sort of prominent, and then production and services the third, and so on and so forth. Again, you know, there's not too much to read into that. It's just to give you a bit of a sense of it. I would imagine that the reason why lighting and sound and audio were quite big were partly because of who was funding it, and partly because of the interest that was generated through the Blackout project, being very much a lighting and sound experience. So of our sample, 58.7% stated that they had currently or had previously had a mental health problem. So if you put that in the context of, you know, national figures at around 1 in 4, that seems pretty high, because we would expect 25% if that was still the case. Another kind of interesting finding was that there was a disproportionate distribution of mental health issues between males and females, with 71% of females stating that they had experienced or previously experienced a mental health issue, as opposed to 54% of men. I won't bother going into all the statistical differences. You can read them in the report. We'd be here for hours if I did that, but just these are kind of just some headline facts. One of the other interesting finding was around age. Individuals under the age of 45 reported far greater occurrences of mental health issues than any other age group. And in terms of those kind of conditions people were reporting, you know, as sort of almost expected in terms of national figures, depression was the highest, followed by anxiety, PTSD, self-harm, and then we get down into some of the smaller sort of mental health conditions. So yeah, and just to emphasize the age thing again, I suppose it was quite interesting that those that were younger were experienced far more mental health prevalence than those that are older. And actually that sort of, it was kind of interesting, because those really early entry people, so we did sample people under 18 that would likely have been in training programs, and they were actually the ones that at this stage weren't, you know, that affected. So only 25% said that they had or previously had a mental health issue. So again, the very early stages in terms of what this says. It was only one quick survey, but I think some of the things that will be discussed a bit later on in this seminar is really alluding to the fact that perhaps there is something that's sort of almost going wrong in the industry, in terms of people aren't necessarily entering with these conditions, but they're developing. Obviously at the moment that's kind of emphasized by COVID-19. We also looked at, in addition to prevalence, we were also looking at attitudes towards mental health and stigma associated with mental health, and there was some interesting findings coming out of that. So participants reported high rates of mental health stigma, at 96.8% of people saying that they had witnessed stigmatizing attitudes, and had experienced negative experiences towards mental health within the industry. There was also an interesting difference between those that either did or didn't say they had a current mental health problem in that relationship. So I guess, so just to give you the figure, those that don't currently or had said they didn't currently or hadn't previously had a mental health issue, only 32% of them said that they didn't think there was any stigma associated, whereas 66% of that group, the ones that didn't have a mental health condition, felt that there was stigma. When you compare that to those with a mental health, that's those with a mental health problem. When you compare that to the ones without a mental health problem, you see a very different things of 50% or 50.1% and 49.9%. What I'm trying to show there is obviously the people that have a mental health problem, with 66% of them feel there's stigma. They're probably the ones that are going to have experienced it or know that. And it was quite interesting that those that didn't have a mental health problem felt that the issue was much less of an issue than it actually was. The vast majority of people felt quite capable of recognizing someone if someone was suffering from mental health difficulties. So 69.5% of people said that they did, and 66% felt that they would be capable to help a colleague if a person disclosed a mental health condition to them, which was quite interesting from my perspective, because that's an unusually high number. Normally you'd expect that to be radically low, particularly with a male sample. So most external research on men and mental health is that they feel pretty unable to help individuals. So in terms of recommendations, I made a series of recommendations. I mean, I'm trying to summarize quite a big report in the space of 10 minutes. I tried it in an hour earlier in the year, and that was still a challenge. So I've probably missed huge amounts of really interesting stuff. But essentially, some of the recommendations that came out of this were the classic one that you can all laugh about, that more research is needed. That's not just because I need more money. It's a genuine issue. We need to delve into these issues much deeper in a range of different ways, with some more qualitative work as well to actually gauge some of those, how those stigmatizing attitudes circulate in society and in your industry. The industry sort of needs to develop, I think, or certainly one of my recommendations were that it needs to develop an actual strategy to address mental health issues. And again, this is sort of, it feels a bit of a strange time to be saying this, but at the time when I was speaking with people, a lot that was coming out was around, contract lengths, excessive hours whilst on contracts, no work whilst off contract, those kind of issues, which obviously at the moment is exacerbated by COVID. But actually, it would be good if the industry came together in that sense and developed a slightly better strategy to help working conditions. I also recommended that there needed to be some stigma and negative attitude campaigns, and I suppose part of the work that I've done with Mig on Blackout was always with that in mind, that actually mental health communication generally changes people's attitudes in terms of negative attitudes and stigma. So those sorts of things I think are a real good step in the right direction. And then I recommended that they move to some or collaborated to offer some industry specific online CBT or therapy, which Alison's going to talk about a bit later on. So I'm not sure it was directly a result of what I wrote, but it helped, let's say. And also, one of the final recommendations was around policy and the need for policy to be developed in terms of time off and individual rights when they're suffering from mental health conditions. The notion of the show must go on, I felt, was inherently problematic if they're really genuinely worried about mental health in the industry. That's probably longer than I was meant to spend. I can't really see the clock on my screen, but anyway, I'll pass you back to Mig and start looking at some questions. I'll address the questions live if there are any, although it doesn't appear there are any.
In my experience over the years, it takes a little while to get people loose enough to. It's a daunting topic to talk about. I'm 40 this year, and I've only just felt comfortable to begin talking about it. So I'm not at all worried about the silence. I think it's not a problem. It's just amazing to have Paul with us to explain to us more about some of the data. It's a very long document. It's a fascinating document. It's very difficult for me to concentrate sometimes, but I actually read it quite avidly and it's really interesting. So I just wanted to take the time to respond to say that I haven't just sat on this information. I've avidly wanted to campaign to carry on and do some active things. So if you do happen to have or have a little look at the document, there is an executive summary, which is fabulous for someone like me that just sort of like gets all the bits and summarizes it for me. And you can have a little look at that. And I pondered that for a long time before I had to think about the ones that I wanted to tackle. What I've done since the publication of this is I've got those 5 key groups back together again. So the industry funders that I got them back into a room, and we've actually been back in a room 2 or 3 times now. We did it once on Zoom, I think, as things started to shut down, and we also did another couple of face-to-face roundtable sessions. There's a lot in there to tackle, and of course we just wanted to look at it from a bite-sized perspective. So the things that really popped out at me were it really hit home that 54.5% of participants stated that they had a mental health issue before coming into the industry. So and that absolutely is me. So I've had bipolar my whole life, so the industry didn't give me this condition. I entered the industry. It doesn't always help, the condition, I might add, but it wasn't as a result of the industry, and that's something that I really wanted to tackle. So I began to talk to these 5 key groups about trying to get together an education steering group. So trying to get together all of our educators in not just in universities, I work in a university, but to get all of the key universities together and the apprenticeship schemes together to begin a cohesive message in making sure that we are teaching our young people to look after their own well-being and their own mental health. And Alison's got some fabulous techniques that she can talk about in her section, but just so that we're sending them on their merry way into our industry with the correct information, and that we're all there's a unity to our message across all of the education establishments. So that's still very much on the agenda, and we still very much want to take that forward to tackle the fact that we are attracting people with mental health conditions even at training stage. And I would say that working in a university, that's very, very, very obvious to me, as I'm the course leader of a theatre production course. So that was the first one that really stuck out for me. Obviously there's a very clear point in Paul's advice about policy and guidance. Since this evaluation, have been elected to be an ABTT trustee council member, which puts me in a fabulous position to do more in industry. So I'm working with the ABTT to try and get together some industry guidance, really, and help in presenting best practice on mental health within our industry, but it's very industry specific. And I'm not going to lie to you, it's quite handy to know Paul in that sense. It's nice to have a mate in the right place that can point you in the right direction. So that is still very much on the agenda, and we would like to take that forward. The last one that really I wanted to tackle, and I proposed some action points in this meeting, was to really look at this stigma section. As a lady that suffers from bipolar, it breaks my heart that people still suffer, are having negative attitudes towards mental health. And it's just been my whole ethos to try and change that thought process. You can only, and the idea of being open is to educate more. So that's been my whole ethos. That's where Blackout came from. Blackout's not gone to bed. We are very much pursuing a VR version of Blackout. There's a renewed interest because, of course, Blackout is a single person show, and it turns out it's a socially distanced show, so it's quite relevant at the moment. So you might see it pop up sooner than we think. So yeah, that was all to do with stigma and things around stigma, but we are also working on some well-being practices in the backstage workplace, so trying to create some resources and data. And there are lots and lots of, there's the mental health charter that you can go online and have a look at, that Pat O'Toole heads up, and there's lots of resources on there. You've got the theatre helpline that's still very much up and running. You also have, but we're also looking to maybe do a few more. And there's a lot of peer initiatives that people have come up to me about and said, what I was thinking about running some sort of social group before a crew call. So the shows are on at 7:30ish, and show call is at 6. we're thinking about coming in at 5 and doing some yoga or going for a walk or whatever else. And so at the ABTT, we're trying to think about ways to maybe promote, produce some material to help promote that a little bit, and just try and get us all thinking a little bit more about being more supportive of one another and more open to the discussion. And that's all to do with the stigma side of it. I'm just going to have a little look at the Q&A.
Yeah, I've got quite a few to go through. I figured most of them I'd do live. So someone has asked, how best can I support colleagues who come to me expressing their concern for their mental health? My view would be you signpost as much as anything really. You know, you can offer the support as a friend in terms of, you know, a cup of tea and a cuddle sort of thing. But I would say unless you're trained in mental health, largely I would avoid giving too much of a kind of thinking you're a therapist sort of thing. It's quite a dangerous ground to walk on. So signposting to local services predominantly at the moment and normally really is, you know, is to the GP. If they don't feel like that, there's plenty of third sector charities that are absolutely superb. Often if someone feels like they've been stigmatized because of their mental health condition, a charity is a bit of an easier place to reach out to. There's probably, I can't remember if it's in the report, but there's probably lots of links in that. If not, there was loads on the Blackout website, I think, that we kept up. So yeah, that would be my advice to that question. The next question is around industry specific organisations, which I guess Alison might be talking about in a minute. And there is also the helpline that Mig will have to remind me of the name of it.
It's a theatre support line. I'm sure Alicia will be all over that. I'm sure she'll post it as soon as she gets it available. I don't know off the top of my head, unfortunately. I'm not that poorly that I need to phone it all the time. I'm much as you don't think differently, Paul. But
I also think there might be a few of them listed in the report as well. I remember putting them in that in some way. Noah asked, what sort of further research are you hoping to do? Lots, really. I mean, this was a real quick snapshot on a very, very sort of low budget. I think that there needs to be a lot more attention in the area for the industry. You know, the obvious at the moment would be the impact of the current situation on the industry and how people have responded to that, because we know that work and mental health are intrinsically linked. I think we'll talk a bit about that later on. But personally, I would like to do a fair amount of sort of more in-depth work with people from different parts of the industry to understand in more detail how they're experiencing their lives, as opposed to gauging prevalence and those sorts of things. That would be my goal. But yeah, I think.
Can I add into that though, Paul, that one of the executive summary statements that you put in there that I still am pondering and I don't really know how to tackle, you mentioned, we had a chat about it, was the shoot up in numbers in female prevalence, over 70% in females, and I as a female, sort of slightly worries me. So, and I also feel like maybe I should be doing something to address that, or maybe further research that. I've hit a bit of a brick wall with it myself. I just wonder what I mean, other than doing more like qualitative research, I guess that's the only way that we can really get to the bottom of that high figure.
Yeah, and I mean, to give everyone some context, we do know that generally on sort of survey measures as opposed to admissions measures, although admissions measures are still similar, that there tends to be more, women tend to disclose more than men in terms of mental health, because arguably the stigma's even greater for the kind of image of the modern, or not you know, the historic man, I suppose, that's shrouded in masculinity. So there is some stuff around that, but yeah, again, it would be really interesting to investigate that. I'm just cautious that I've got quite a lot of questions to get through, so I'll rattle through them quite quickly. Thank you. So help someone who is severely depressed. Again, it goes similar to the response earlier. It's really about signposting, offering the friendly levels of support, but without taking on board this kind of identity of some sort of therapist. I guess just to emphasize that, I suppose, you know, my trainees do 7 years of training before we let them loose on their own. They have 3 years of that at doctoral level where they're under supervision by senior psychologists. So there's a lot to this, you know. So I think, but at the same time, informal, friendly care is just as, you know, is a really, really important thing in people's lives. Oh, that one's gone. Mental health is first aid is pretty prevalent in offices. I was wondering what your thoughts are on providing this in the theatre industry is effective. Is it effective to train? I think any additional training's going to be useful. It's going to help. It's going to raise awareness. Arguably, that's going to then reduce stigma. I've had a slight concern about mental health first aid in what it isn't to do is I mean, it's very badly branded, I'll be honest. It's not first aid in that if someone collapses, you can do first aid and you might keep them alive. The likelihood is you probably won't anyway, but you know, at least you know some techniques. When it comes to mental health, if someone is in a really bad way, I would say signposting to professional services is probably the best way forward, but that's my own opinion. How long do you think that erratic, often antisocial hours? Yeah, they absolutely do. There's no doubt about that. There's plenty of research on shift workers in different industries and the negative impacts on mental health. There's research on frequent business travel and the negative impacts on mental health. So absolutely, working conditions and hours are a challenge, right? What else has I've done that one? They keep jumping around. They seem a bit vague. Why is mental health not considered as important as physical health? Very good question, Danielle. I've been wondering that myself for years. It drives me absolutely insane. The NHS has been debating this for years, whether services should be combined or separated. It really should be seen as the same, would be my view. I don't know. It's again a historical issue of, you know, the kind of traditional view that either people with mental health issues were either insane or weak. That's kind of a historical, you know, that's where the stigma largely comes from historically.
I think that's actually a societal change, Paul, because I realised in my own journey with my condition that I actually was carrying some of those thought processes as well. So like I wasn't, and I still often, my husband says to me, you've got a severe mental health condition, darling. It's, you know, cut yourself some slack. Do you know what I mean? So I think it's a societal change that it's not going to happen overnight.
No, absolutely not.
And I would say that it was a lonely place when I was 17. It's much more inviting now than it was back in the day, but there's still a long way to go.
Yeah. You wouldn't try to run a marathon with a broken leg, you know, so I don't know why it's viewed differently, but it is. Paul asks, are there any industries where mental health is being tackled well and in a positive way already? I've actually always been quite remarkably amazed by the theatre industry, and that you're actually trying to address this head on, which is quite remarkable. I'll be perfectly honest with you. Yeah, so in terms of other industries, most of my work's with the NHS, and they're probably further behind in this than you are, I think, in terms of trying to actually tackle it. So that would be my honest opinion. You're making steps in the right direction. I don't know what the time is, but do I need to reply to the rest of these written, Mig, or have I still got a few minutes to?
You can do. I think let's, like I said, we've still got plenty of time, but I think if we stop the questions now and we'll go over just to give you a little bit more of positive news, we're going to let Alison talk now. Alison's doing some fabulous, so Alison's been commissioned to do some work, so I've brought her here to talk about what is happening. There's my sincerest apologies, but with this current situation, not a lot is actually happening, and I've not been able to do much, but Alison's been commissioned to do some fabulous work. She's going to talk to you a little bit more about that.
Hi, I've been sitting here kind of writing notes and squirreling away as this has been going on. And one of the things that I think Paul has already pulled out is the higher proportion of women. I'm also mindful that women are more likely to seek help than men are. So again, it's being aware of statistical evidence and what might be underlying some of those things, which I know Paul's already suggested. And somebody did ask specifically about mental health first aid, and I would say whilst it's not perfect, certainly isn't, one of the things that it has done is given people a bit of confidence about having a conversation with someone around mental health. And I still think that our biggest challenge, and this is right across the spectrum, not just in our industry, is finding the right language to actually have a conversation without feeling embarrassed. There's a little exercise that we do, which we call the graffiti wall, which anyone who's done the mental health first aid will know this, and how easy it is to find all the negative words to express things about mental health conditions, and how difficult it is to find some positive ones. And certainly in terms of critical incidents, if somebody is suicidal, for instance, a lot of people don't know the basics of, well, who do I signpost them to? What's going on here? And I think that's the critical information that doing some of these courses can give people. Because signposting is okay if you know where to signpost. But if you've not even got that basic information, then you're always going to struggle. And I would say don't underestimate the power of actually just being a listener. A lot of time actually giving your ears to somebody. It's not about giving advice, because you're not qualified to do that. It's not about trying to tell people what to do. It's actually just listening to them and then supporting them to access advice. And we know that, well, I certainly know from experiencing dealing with people with severe depression, it's draining for people as the support, not just the person who's also suffering. So I think the more knowledge you have, the better able you are to start that conversation. And it still surprises me now, every single course I've ever run, the amount of people who just feel they don't know how to start that conversation, what words to use, what's appropriate language, where to start, and how to go about it. So I think if nothing else, doing some of these mental health training programs helps massively with that. And in terms of my own background, well, my background is more in the moving image, certainly doing photography, camera work, and working in the commercial and corporate sector, and also music video. So I've been a member of BECTU for 20 years. And then I started working with them as in training and development. And it was through that I actually came across mental health first aid. And I trained initially as a first aider. And whilst I hear what Paul's saying, this isn't the same as trying to treat, stem a blood flow. But actually, for me, it was about giving me knowledge. And at a time which was really critical for me, because I was dealing with several people, some were suicidal, and absolutely having no idea a lot of the time about what can I do, how can I support or signpost. And on the back of that, that's why I chose to train to become an instructor. But I also recognise the faults in a lot of the programmes and the lack of education right from the outset for people. Because mental health conditions, we know, predominantly start in people under the age of 18. But how much are we actually supporting young people to understand mental health and their own well-being, and giving them a space to be able to have those conversations there, actually building it into the education system, and where that all links and how that support is aggregated at each layer and stage of somebody's life. In terms of then where I've been commissioned, it's really been around kind of new entrants level predominantly, and thinking about the sector we know is a challenge, exceptionally long hours, working weekends. There's no distinction between evenings, days, weekends, all of that become just one working period. The challenge of being freelance in an industry is quite brutal. And actually to sustain yourself and sustain a living in this industry, you're going to be a portfolio career where you'll be jumping from one job to another. You'll be continuously under pressure and stress Where's your next meal going to come from? Can you pay the next lot of rent? What about your mortgage? What about the kids? Can you take some time out? It's an unforgiving sector right across the spectrum. So for me, it was really, well, actually the first approach to any kind of mental health is looking after yourself first, because if you're not looking after yourself, then how can you possibly support anyone else to access and find support? Which starts with the basics of, look, what is good health? Mental health and physical health are not mutually exclusive. They're intrinsically linked. We know this, but quite often we want to treat mental health as something that's, you know, either good or bad. And in fact, it's not as clear cut as that. So what can we do for ourselves to help? And I did see in some of the comments, you know, it's not just to oh, and do this, eat well, go and exercise. Yes, that's part of it. But also to be able to have some time to reflect, to understand how you work, what your own triggers are. So many of us are just, we're not neglectful, not intentionally, but we're probably not questioning ourselves. So the sessions that I've developed are just 1 hour, and they're interactive. And it was really about getting people, one, connected, and particularly in times of isolation. All the programs I've been doing have been through Zoom. When we're feeling isolated, that impacts massively on our other challenges anyway. So just for 1 hour that you could put everything aside, come together with a group of people you may not have even met before, and talk about anything that's affecting you, and maybe come up with some simple techniques that you can use yourself to help reduce those stresses and anxieties, which are often the ones that become unchecked and develop much further. So that's been commissioned. I've already delivered some with Screen Skills, who are the sector skills agency for film and TV broadcast. I've done some for BEC2, and I'll be doing some more of those. So if any of you are BEC2 members, they are free on offer. So you can, there's going to be 2 in June and 2 in July. I've been doing some, one of the things, once anybody knows anything, out across the social media spectrum, I work with so many people who are struggling. So I do loads of just, actually just letting people talk. Just, how are you doing? And I always say, never underestimate the value and the gift you can give someone and just asking them if they're okay. Because a lot of people do think that they would know if someone's not. And actually, quite often they don't, because they're not paying attention because they haven't got time. They don't know. You're so entrenched in what's going on, either when you're on a job, especially because, as we all know, budgets are tight. We're trying to do multiple things. We're working to tight deadlines. Our focus is fully on the thing that we're doing. We're not always mindful if somebody else is not doing it okay. And added to that, the stigma and discrimination that is still the biggest single issue that people face with mental health conditions. People don't feel confident to have that conversation. Another question I always ask when I'm doing training is, honestly, how many of you would disclose the fact that you had a mental health condition to your employer? And, maybe 2 out of a room of 16 would put their hands up. So we all need to move to that place of better understanding through some education. We have to educate ourselves, go and spend some time and learn about it, find an appropriate language, find an ally within the workplace. Human resources is not always as it appears it should be. But just by the title, you get a handle of where they're really aiming things at. And I think there's just still such a vast chasm in terms of sensible information that's out there, safe spaces to talk and have a conversation, and a reduction in stigma and discrimination, which is preventing people ultimately seeking the help that they need. And I'll shut up at that point.
Thanks, Alison. I think you brought up some really interesting topics for us all to consider, and I'm just looking at the chat and the questions, and it's certainly sparked an interest. The couple that I just wanted to pick up on, I did train as a mental health first aider. I did feel like a bit of an imposter in the 2-day session, I'm not going to lie, being that I suffer with bipolar disorder. But it was interesting. It was an interesting couple of days. The one thing that I would say is that a lot of people have asked about how they begin to support someone or how they begin the conversation on mental health. Nobody ever talks to me about it. It's still very rare that people are brave enough to engage in a conversation about it. And as a sufferer, actually, it's nice sometimes if someone takes an interest. So I mean, I've been very out there, I've been very open about my condition, and actually you'd think that lots of people would still talk to me, but people don't. They still don't. So you know, and again, it's what I was saying to you about a cultural change, really, and doing it that way. There was also another really interesting question in the chat about education, and about how to educate our young people. Again, like, in light of the fact that I haven't got any of these policies and procedures up and running in these steering groups, Paul answered that question from an education establishment point of view, because of course if you're in a university there should be some wellbeing support for you. From an industry point of view, what I do for my students is it's very important to teach them how to hang a light and, you know, rig a speaker and be a stage manager or whatever else. But actually you must teach the soft skills that are required in our industry. You must teach them some resilience to deal with the working conditions that we currently find ourselves in. So we do work long hours. So the best thing that I can do for my students is to campaign to make sure that the working hours are fair and be linked with industry in order for those changes to happen, but also to make sure that my students are prepared for that before they go into industry. I spend the entire third year with my lighting students just talking about soft skills. And by soft skills, I just mean the lighting designer that's particularly rude, just reminding that lighting designer about the correct etiquette to talk to somebody and about how it is not appropriate to talk to somebody badly, whether they have a mental health condition or not. We should all engage and talk to people in a manner as like that we would want to be spoken to ourselves. So I call it soft skills with my students, and so that's the best that I can do for my students at my university, to get them industry ready and more resilient to enter our unique working environment. Do you want to tackle any more questions, Paul?
Sorry, I was just writing a response to one.
Oh,
I might as well just say it. It's probably quicker. Someone had asked, do you think that if the industry is causing your mental health rise, should you give up on your dreams and passions instead of suffering through? And I was just writing that I don't think it's quite that straightforward, in that this is going to vary from individual to individual. I think that if this is, you know, it depends on the severity of how much of an impact it's having on your mental health. Because if ultimately if it's putting your life in danger, then probably yes. But if it's not, then you'd have to balance it against how much giving up the dream would negatively impact your own well-being anyway. So yeah, I think it's a probably more of a complex question than I could answer. And
let me so yeah. I'm a living advocate that you can achieve anything. You can look at me now. Like, how many people are we hosting here? You can change it around. Just because you've got a mental health condition doesn't mean that someone can tell you that you can't achieve whatever it is that you want to achieve. I'm still very much battling my condition, and it's flared itself up because of this current condition. But every year that I go by and I get through and I educate myself and learn a little bit more, I get tooled up more to deal with it and move forward. I would say to whoever wrote that question, if you really are suffering, never suffer in silence. There are managerial processes to go through to make the correct complaints. If you're having problems with a particular individual that is aggravating your mental health, then there are procedures for that. We have unions and things in place in order for you to go forward. You shouldn't suffer in silence. And I don't think that your career, you should have to change your career in order to do that. But yeah, the long-term effect is if somewhere I have left jobs because I feel that I don't know, I no longer enjoy them and stuff, and of course they're life decisions and we do them in life as we go along, don't we? But you shouldn't give up on your hopes and dreams because of something, because you can learn to live with them and deal with them and get on.
So there was a question from Peter asking about, was there a difference between people that were part of a touring crew or theatre company because they become closer as a kind of group? We didn't explicitly cover touring crews or the kind of composition in that sense. So I from memory, without sort of going back and maybe redoing some analysis, I don't think we would have that data at this stage in terms of how people's workspace was composed. But I mean, yeah, I would hazard a guess that it would have an impact. If the small team was particularly nice and supportive, I would imagine that being part of a nice, small, supportive team would be great, as opposed to an individual that's freelancing, you know, going from place to place.
I can answer that. We definitely didn't.
We didn't do touring, did we?
No, I don't believe it was. So you just have to bear with us, because when Paul was saying that he turned this around in about 2.5 weeks, he really did. So we had a round table meeting. It took a long time to procure the funding to do this, and then the turnaround for it was very quick. So yeah, it wasn't as extensive as we would have liked to have been. And of course, at that round table meeting, trying to meet everybody's expectations was difficult. And of course, some things, you know, you have to give up some things in order to get other things in there. And like you said, there's definitely room to do some more. There always is room to do further research, but you'll just have to bear with us at the moment, because of course there's slightly bigger issues we need to get open first before we can tackle some of this now. But whilst there's breath in my body, I will continue to do that.
Sorry. Yeah, sorry, I just wanted to add, because the research is going on across the industry. The Film and TV Charity have also recently just published a massive piece of work that they've been doing at the end of last year, and they've just launched an online platform to enable people to connect and talk and share their experiences. There is I know that we've been approached through Mental Health First Aid England in terms of additional people to support the Shout, I think it's Shout project, where you can get text support. So you can text for help if you're struggling. And I know that they've just done a huge increase in volunteers to join that project. So you can check that out online, I think, as well. But I do have the report from Film and TV Charity, and they're about to commission more research that I'm hopeful we'll be able to work towards as well.
Paul, do you want to? We've still got plenty of time, but just because it's very rare to have someone outside of industry with such a specialist in the mental health field, Paul has been doing a lot of work in the NHS on research that they're currently doing to do with COVID-19. I just wondered if you could just give us an overview of what you're currently doing.
Yeah, and this sort of ties into some of the questions. I guess I don't really want to bang on about COVID-19 too much, because everyone's sick of the phrase, including myself, that this has been all I've been able to think about for the last 10 weeks or so, partly because all of the research projects for my entire course of doctoral trainees have pretty much ended, because they were all in secondary care mental health care units, so which most of them have been suspended. But I guess it's kind of pertinent to think that at this moment in time, there's two things for the industry that become really prominent, I think. One is obviously the pause has the potential to create a new future, I suppose. And I know we're all thinking about this in different ways. So some of the questions around what could be done, I suppose, would be maybe not going back to exactly how things were in the past. But again, I don't get involved in the complexities of financing an industry. In terms of what other people have said around mental health and this current moment. I mean, we know for a fact that job insecurity enhances mental health prevalence across populations. We know that death anxiety or general anxiety increases at times of public crises. We also know that the sort of psychosocial impacts of SARS were enduring. They were quite severe. We know that frontline workers and key workers, it's even more enhanced for, because of the fact that they're faced with effectively a silent threat on a constant basis. So we know all of these things. So the project I'm doing with the NHS is to try to explore some of these in the general population, utilising concepts around death anxiety, for example, or the other two areas we're really looking into is guilt. So the extent to which people are regulated by guilt as emotion in the current climates, because ultimately people feel guilty that they're not doing enough. People feel guilty that they're going to the supermarket and potentially spreading the virus. There's all sorts of issues around guilt. And then we're also then exploring notions of moral injury. And that's not just really episodic moral injury, so not moral injury where it's a particular event, but something broader around the ways in which systems and structures have effectively betrayed people. So particularly for NHS staff, obviously we all know that there was no PPE at the start. Systemic failures have led to the deaths of NHS staff. That has an impact on everyone. We also know that there's kind of moral betrayal in terms of the ways in which services have been operated. So if you're an inpatient, a learning disabilities ward, or older adults ward, you'll be seen by a social worker but not a psychologist, because social workers are cheaper. As brutal as that sounds, that is the way that things are being run at the moment. So with all that in mind, obviously it's kind of an expectation. We've got this evaluation going on at the moment with the general public to look at prevalence rates, but it's fully expected that with the current context that prevalence rates are going to be severely higher than they were before the event. So that's for people with existing conditions or without. For those with existing conditions, there's an added layer of complexity in that, as I said, secondary services have largely ceased, or they're definitely not being they're not being offered in the same way. So most, there really aren't any secondary services for mental health that are being offered face to face. There aren't any face to face group work going on anymore. So obviously, if critical services are still running, but if you're in what we call secondary care, I still see it as critical. NHS staff still see these things as critical, because it's a very, very fine line between someone that's suffering from, clinical depression, between that line with no support and that line with support. The person that's then no longer able to access support, and also on top of that is fearful of even going to their GP or to an A&E, presenting at A&E because of the fear of COVID, etc. So the current climate is a hot pot. There's nothing really good about this in terms of mental health. So I don't know if we want to hear a little bit from Mig, putting her on the spot. We did discuss this earlier, so I'm not actually putting her on the spot. That'd be pretty mean of me to do that. But just
grill
about
me. I knew you'd grill me.
Just about, as someone with bipolar type 2 that doesn't have the same access to services as you previously would have done, even if you were in service care or not, what's the last 12 weeks brought for you?
Yeah, so with bipolar 2, you have so I go through cycles of manic depression and hypermania. So I don't hallucinate. I have elevated moods, more so than your average person. My mind will start racing. I start to do 100 things at once, and I actually have trouble calming down. it leads to sort of lack of sleep. And my cycles for that, I generally have around 2 manic low episodes a month. And in the lockdown period, the symptoms of my bipolar have tenfold. So I'm now having 2 manic low episodes a week, and it's just tiring. So it's very, very tiring. I've managed my condition for a very long time, and I've just had to it's about sort of being self-aware a little bit, and yeah, I just had to phone up my GP, make those really awkward phone calls. I'm actually doing a project with Blackout at the moment about how awkward it is to make those initial phone calls. So we are still doing awareness projects on that particular topic, and if any of you are out there that are struggling, I totally get phoning a doctor is just not the easiest thing in the world ever. Like you have to get past the receptionist, and they're always really troublesome. But yeah, is there anything specific that you wanted to know? I mean, you have to go through layers to get, like, because Paul was talking about primary and secondary, what did you call it? Primary and secondary
care.
Yeah, so what he's talking about with that is I'm the secondary care, so my condition is considered a little bit more serious than the primary one. So initially, Paul, they offered me some CBT sessions, which are only available on Zoom, but lovely that they're still trying to do them. But it's very actually, it wasn't on Zoom, it was on Skype, and the only way that you could engage with the guy was on chat. And I'd spent all day teaching and stuff, looking at the screen. I remember texting Paul and just going, no, this isn't going to work. But yeah, so I've now been sent back to my community mental health care team, and they're now looking at medication and all sorts of different things. So firsthand, I know that the current climate is presenting as, so all of my routines and structures have changed so much that actually my condition can't cope with it. But it's just about taking a breath, putting my hands up and going, do you know what, that I need to just admit that I need a little bit of support and extra help through this period, and then maybe when we come out the other side of it, I can resume how it was before. Is there anything specific? It's difficult to know, really, because I've got a box of tablets on my shelf on the boat that I haven't taken yet. I told you about those, didn't I? So yeah, and it's a very big deal for me to I will take them, but it's mentally, it's a big thing for me to have to go back onto medication, but sometimes you do need it. So
in terms of, I guess, to give the audience a bit more of a sense of a feel for the current situation, are there things on a daily basis that have struck you? I mean, you mentioned patterns and routines that have had to change. Is that the primary impact for you, or is it seeing death statistics on a daily basis on the news, or can you just talk through a little bit more about your understanding of the current context, I suppose, and its impact?
So initially, when we first went into this, with the Boris was doing a daily read, like I'm sure he still does it, I don't watch them anymore. So but yeah, it's hard not to get like completely tied up into that, watching that every day and looking at the figures and stuff. And social media and all the nonsense on social media can be very enticing. And so very quickly I started deleting those things and alleviating that from my world in order to streamline my world a little bit. But for I don't really, my husband suffers a little bit with anxiety, but I'm not scared of of coronavirus or anything like that. It's changed my world so much. That's what's annoyed me, and that's what's made it difficult for me to understand it. So I believe it or not, I'm not the greatest social person, but I got used to the exercise of going into work and whatever else, and it's all just sort of changed. Staring at a computer, I hope you all agree, in industry We run up ladders. I didn't elect to stare at a laptop all the time when I decided to take a vocational degree in lighting design. So, but now the only way that you can engage with life, it would appear, is on Zoom or in this particular platform. And so, yeah, I think my head is struggling to stare at a computer all day because it's not necessarily what I want to be doing. I can't exercise or run as much. I don't have any childcare. I'm sure it's all the same issues that everybody else has got, but yeah, it's just that my head doesn't work the same as everyone else's and can't cope with it. Anyway, you should be telling me why my head isn't coping very well with all these things with your doctorate.
That would be a bit much in front of 26 people, right?
Yeah.
But no, I think it's important just to hear that though, because I'm sure that out of the participants here, they can probably relate to a lot of that, in the extent that we're seeing a greater prevalence in mental health at the moment because everyday coping mechanisms have gone. We're also seeing, in my opinion, as someone that's not long ago written a book on community psychology and the importance of social networks in informal mental health care, we've seen that you've not been allowed to socialize. The impact of that is enormous, and that can be from the silly little things like, I coach my son's football team. There's 4 of us that coach them, but that's twice a week, every week. The 4 guys meet up in control of 30 kids. They drive us to delirium after a long day's work, but we talk in a way that, certainly as a bloke, I wouldn't phone up a mate and talk. All of that goes. So this is going to be the same pattern for everyone. On top of that, for your industry, obviously, Mig, you're employed by the university, but for a lot of the participants, I imagine, they're self-employed. Income security is gone. That's a big, again, a big factor in how people can relate to their own lives. And then the uncertainty, particularly for this industry, in terms of when the hell is it all going to end. So I think there's some really important complexities there. And I think, reaching out at a difficult time is good. I mean, services are overrun, as I'm sure everyone's read about in the paper, but I do think, I'm a massive advocate for the fantastic work that happens in the third sector, in the charities, in your local, stuff that you may have gone to in the past, which I would have been advocating for years. I have been that, use your community centres, use your, cycling clubs or whatever it is, those informal community spaces. Obviously you can't use them in the same way anymore, but a lot of their stuff has, again, it's kind of gone online, and I think those informal support networks are super important. I mean, yeah, and they're looking at
resources out there, and so in my local area alone, there are safe havens. So if I go into crisis, into a manic low, there is somewhere that I can go. Weirdly, it's only open until 11 o'clock at night, so of course let's hope you don't go into crisis after then, because there's no support there for you. But the evenings tend to be when you struggle the most. And interestingly, when I phoned, I did actually, I'll be really honest with you, I phoned a crisis line. Weirdly, I didn't phone the theatre crisis line. I phoned my community one in Surrey, because I'm under that care. And they still run the safe haven spaces. You can actually still go into them apparently, but they also run a virtual service as well. So again, it's another Zoom room, but I still, it's not, none of these things are ideal, but what I find quite interesting is they're still trying the best they can. They're still trying to support you. So the one thing that I can advocate in this process of going back under the care of my community mental health care team is that they are doing their very best for me. It might not be perfect, but they are, they are still, and it was a painful process to get through the receptionist, through the GP. Then you have to go and get assessed the first time, then you probably end up going to someone else. So it is a painful process, but if you can get through it, they are doing their very best to support you. I've had a question that was really interesting that Alicia has highlighted like 3 different times. So it says, hi Meg, how do you communicate with your work when your illness when you just need time off, and when I'm, I guess when I'm poorly with bipolar, I guess, or I'm not feeling great. I'm just going to be really honest with you, I'm still not great at that. I'm of a certain age where I was brought up in a time when we didn't talk about it, so I'm still very much learning that, and I'm still trying to practice what I preach in that sense. So I don't do as well as I could do, is the answer to that question. But there have been times where, particularly during the last 12 weeks, where I've just had to put my hand up and admit defeat. Thankfully, it hasn't affected my ability to teach too much, although there was one day when I just couldn't indulge in that kind of face-to-face activity. I still managed to work, but I just worked in a different capacity for that day. I'm very lucky to have, obviously my place of work, in a university setting, well-being is very, very important at the University of Surrey, and at GSA. And obviously because GSA supported Blackout, and also because everybody now knows I've got bipolar disorder, of course it's a common knowledge, it is a little easier for me. But I still find it, I kind of feel defeated a little bit, is probably the word. I should imagine everybody feels a little bit like that. So that's kind of how I feel at the moment, that I feel like I really wish that I could be managing better, but I'm not particularly doing very well. But I have great colleagues that I work with, that I've been able to talk to. And actually, I'm going to big up my students here, because actually in being very open to my students, they've actually been very understanding in it as well. So it's a two-way thing of communication, really. So yeah, I need to get better at it, though, would probably be the word for it, would be the answer for that. I feel like we've got loads and loads of questions. Do we want to start? We've got 15 minutes.
Yeah, let's start. So I've got my first one. I guess we all see the same questions, do we?
Yeah.
I've never used the questions bit, only the comments bit, but never mind.
You've got the fancy webinar one there.
Yeah.
Cool, yeah.
So, any advice for individuals with social anxiety, poor social skills in terms of networking, making it a whole lot more difficult? I mean, from my perspective, I suppose it would be around actually seeking support for the social anxiety to then help, but I mean, I don't know if Alison and Mig wanted to sort of add anything to that.
Yeah, it would be interesting to know what your specialism is. I know there's it says anonymous attendee, but I wonder if you could put in the chat or something what your specialism is. If it was something like lighting, for example, you don't. There are ways and means of managing that. You don't have to be a social bug in order to do it, to get by. But I suppose it does very much. If you're a stage manager, it might be more difficult, because of course that's very forward facing. So it's sort of, I guess it depends on your specialism, really. And also what kind of career path you want to go into. So if you're going to do lighting, for example, I have students that aren't as outgoing as others, and there are other career paths that you can go down into in our industry, into the manufacturing area and R&D and stuff, where you don't have to be in those social situations. But yeah, if they are causing you big problems and they're impacting on your life, then yeah, do what Paul said. He's a doctor.
Mig embarrasses me about this. So anonymous, additional to yoga.
Additional to yoga, going for a group walk, because Mig suggested we're cooking a meal together or eating a sit-down meal. Often backstage companies are very overworked, and I've only had Tesco's meal. Yeah. So so we're just trying to promote good practice. So we will absolutely get round to that, but we're trying to advocate best practice, and that's very much what we were doing before we were told to stay at home. So we'll resume back with it as soon as we can. Yeah,
and just to add to that, the sort of informal, random stuff that people find helpful is vast. So I mentioned a community psych book recently. That was in that book there was chapters on fishing, fishing for older people with younger people. There was a lovely charity we worked with in the Midlands. There's stuff on cycling, there's stuff on singing. It's, eating. We worked in the Brighton Unemployed Centre in Brighton, and that was just a space really where sometimes they would give cheap meals as well. But all of those spaces, it is informal mental health care is absolutely essential in those spaces. Obviously, the spaces don't exist at the moment, don't get me wrong, but when we return to some level of normality, I would massively encourage it.
Yeah, you should absolutely answer that.
The one that's just popped up.
That phrase. Paul hates that phrase.
Yeah, so why is the phrase "the show must go on" so worrisome? For me, as a mental health professional, it's alarming and tragic at the same time, because I simply don't think there's anything more important than the possibility of someone taking their own lives or hurting others. I have no vested interest in the industry, so it's one of the few industries I've only ever heard it, and I do appreciate that. Yes, a performance is on a particular night for a particular reason. There's an audience there, but for me personally, I'd rather see the audience turned away. But yeah, so I hate it. Mig knows I hate it.
Yeah. Well, like I said, we're dealing with a national social crisis in that sense, culturally, on mental health, and I think we're slowly chipping away with it with national campaigns and all the mental health charities. But likewise, we're trying to do it in our industry as well. So yeah, we do have this mentality of the show, and I'm brought up in that generation. Turned 40 this year, absolutely. Just come hook or crook, that show goes up, doesn't it? And if it means you haven't been for a week or you haven't eaten or whatever, that's culturally what we're brought up for. But it does need to change, and it has. And in my career, I've seen working time directives to being adhered to, and it's a slow process, but we can only keep having these conversations and pushing these agendas in order to do that. And it shouldn't be that case. So I was talking to Gav at Pirate Crew, and his he goes on about the show must go on, but I say the show must go on, but we need to look after each other in the process. We'll get the show on, no problem, but let's be kind to one another in the process. So I think we should change the phrase to the show must go on, and we'll do it, but let's be kind to one another as we get there. So Pat's talking about her mental health charter. So she's been doing, Pat, Paul?
Yeah, I recognise the name, but I can't, yeah.
So Pat's done a mental health charter. Pat, I don't know, you might want to put a link for that in the chat for people to see this. It's a lovely pool of resources, very industry specific. She's asking how she can get more federations and institutions to sign up to it. I think the reason there's no appetite for it, Pat, is because I think some of these institutions hide behind the facilities that they have. Like, for example, the University of Surrey and GSA very much have their own wellbeing support provision, and so of course they think that that's resolved in that sense. But what you're doing is an industry specific one, so I can only keep advocating what Pat's doing, which is bringing together industry resources. Can you answer this one on Zoom fatigue, because this is a thing?
Is there something to be said about Zoom fatigue? Yeah, Zoom fatigue and social media fatigue and over screen use fatigue is endemic at the moment.
Is there anything that links it with negative, to do with mental health, like negativity in the mental health aspect?
It's a really tricky one. So the research on this is pretty sketchy, because obviously the focus of previous research used to be on the use of it for fun as such, the overuse of social media, not necessarily for fun, but as a social resource. We haven't ever encountered a time where anyone that can work from home on a computer screen does, and so there isn't really that much about it, because the only other studies have been done in offices where people were using screens. But that's as we all know, well, certainly from my perspective, sat 9 hours of back-to-back supervisions with trainees on the same screen is nothing like doing 9 hours of supervisions in an office, because I don't bump into my colleagues, I don't have that informal. So I think there's huge implications, but at the moment there isn't much research. I'm sure there'll be stuff going on as we speak, but it's not something I'm doing. Alison.
Just regarding the Zoom fatigue, yeah, definitely is a thing. And I think the difference with Zoom is, especially if you've got several people in the room and you're trying to look at everybody's face at the same time, as well as actually looking at your own face, which is really disconcerting. So you find a lot of people switching their cameras off just so they can focus on who's actually speaking and taking the information. And I think particularly if you're neurodiverse, these things, especially for me, if I was seeing 159 people or however many's here, that would have me peeking all over the place because I wouldn't know where to put my focus. So yeah, it is an incredibly wonderful tool. It at least keeps people connected, but overuse, I think more than 3 of these a day, and I'm absolutely exhausted, especially if they're substantive and quite long.
Yeah, I think we have to be kind to one another. I'm the worst at it, the worst, because of course the demand from us is high. I'm a course leader, you know. Alicia and I have spent all day staring at this, so we're not even following our own advice. So again, I think we just need to sort of need to learn, don't we? There's been a couple of recurrent questions linked about people's anxiety and apprehension about the current situation and going back to work. So obviously we're shut at the moment, but there are some instances of opening up. So the Royal Opera House are doing some live shows, not to an audience, but some live shows. And if you go onto Gav Pell's Facebook page, he often lists what pirate crew are doing in terms of live events. It's not much, but there is stuff opening up, and I just wanted to let any of you know who are suffering with anxiety or worrying about it that lots and lots of good work is being done to make sure that you're going to be looked after when you do go back. So there's lots of extra layers of health and safety and method statements, and all these people are coming back together. But you're absolutely right, we should be in all of that. We shouldn't just be concerned with numbers on a risk assessment and method statements to do with masks and social distancing. You're absolutely right, we should be considering people's anxieties and perhaps their worries about coming back to work and looking after people's mental health. And in every room, my promise is that in every room that I go into for these industry chats and discussions, I will always have my own mental health and the mental health of my industry at the forefront of my mind. So it will always be something that I bring up in every room. So I hope that answers that question. And you know, when the doors do open, we can know that I will think about that.
Just to add to that, interestingly, we had a discussion about this in my branch meeting about the risk assessments for the return to work process. And a lot of production companies and organisations are actually consulting with their insurance companies. So the insurance companies ultimately are in control of what's considered or deemed to be reasonable level of risk. Whilst I understand that, some of them are quite low in terms of what we would expect as a union, for instance. So it'd be interesting to see across the industries just what those risk assessments look like and how, you know, whether or not there's going to be any standardization on that, just to kind of put people at ease, because anxiety is high, and particularly in our industry where you're touching and sharing equipment and, you know, you need to be working in pairs. It's a massive issue. And we've already started talking about the use of high grade masks, because there will be situations where you might have to work in close proximity with others, otherwise you won't be able to do the work itself. And that equally also has other anxiety issues for a lot of people. So I think we're going to see a lot of that played out over the coming months, but just to be mindful that ultimately what will underpin it all will be the insurance companies and what they will allow as mitigated risk.
So we've got 5 minutes left. So I've just I've picked out one that I quite often get asked actually. And do you think that your condition would affect you gaining employment if your prospective employer were to know from the outset? I guess you're asking if I'm honest about my condition. So I up until now, no, not at all. So the day that I publicly made Blackout and the press release went out was probably the day that I started to become open and honest about it. It still fascinates me that my position in industry is elevated to this point where I'm hosting these, for example. So obviously I can confidently sit here and say that the opportunities that have been bestowed upon me in industry to progress my condition has not hindered that. Everybody knows that I've got this condition, so everyone's been really kind and it hasn't hindered me at all in any way, shape or form. Do I think that it would have hindered me early on? Yeah, I totally still get why you wouldn't mention it. And I quite often, so I present very well most of the time, although there've been most of you wouldn't want to catch me on a bad day, but I do present very, very well. I actually have the opposite with my the way that I present, in the sense that people often forget I have this condition. And so of course the expectation gets more and more and more. Oh, you're a course leader and you're this and you're that, and can you just do this and can you do that and can you do this? And then actually it's almost like I want a little flag around my back going, by the way, I actually do this. I actually have bipolar 2. So there's a danger that actually you can in not being honest, that you can take on too much. But I still advocate that you can achieve as much as you want to do. But there's a lot more work to do in that area, I think. I mean, Paul probably can give you some statistics as to how many people do actually declare it. I don't think, because there is still that we haven't tackled the stigma completely. That's the problem. And especially if you're early on in your career, so if you're literally straight out of drama school, having done a degree and you're a really fabulous lighting technician, but of course you've got no real CV to speak of. I've got a wealth of experience that I hope people would take into consideration before they see my label of bipolar 2. But if you're young, I would appreciate that actually without that, you don't want to become their mental health condition label. And Paul Hanna can talk to you for days about labels. He doesn't like labels. So
yeah, I guess just to build on that, I think it's not just in your industry. I have trainees that don't disclose existing mental health conditions, and they're trained to be clinical psychologists at doctoral level. So it's unfortunately, this is huge systemic changes that are needed to alleviate mental health stigma. We've moved on since the 80s. We've got an awful lot longer to go. I mean, we're nowhere near anywhere at the moment, in my opinion. There's so much more to do. So it's not a jolly note to leave you on. Cheers, Mig.
Go on, say something inspiring to end it. You've got a minute.
Oh, I mean, just something very briefly to inspire around accessing services there. Although services, phoning that person up is awkward, etc. The people, as Mig said, the people that you end up with, you couldn't wish for more passionate individuals. So do it. If you're struggling, definitely do it. And we're going in the right direction on a social level and on an industry level. So.
And you got it from the horse's mouth that actually, as an industry, we're doing more than most. So, yeah, thanks. I think we're running into time, which is fabulous. So I know that there are some active questions still in that question box. Listen, you know where I am. I'm not going anywhere. I'm happy to answer questions if anyone's got anything else. Thank you so much. We are so flattered to have so many of you here with us talking about this subject that nobody ever talks about, which is brilliant. So it just remains for me to say thank you to Alison and to Paul for joining me. It would have been quite a lonely discussion. It felt like therapy almost if you weren't here to back me up. So thank you. And it is honestly, Paul, he's a really good friend and he's a busy man. and I drag him around everywhere, bless him. And thank you so much. It's really lovely to hear your opinions on stuff, so thank you. Cool, so I'm just going to wrap this up. I just wanted to say a thank you to David and to Alicia, who have been our backstage team today. They've been helping manage the chat and the Q&A whilst I've been on this particular panel, so thank you very much for doing that. I also just wanted to publicly thank the Guildford School of Acting and the University of Surrey. They've kindly allowed us to use the webinar platform to host this, so they've been really kind in order to do that. Today's session and all of the series of seminars that have been brought to you by the Association of British Theatre Technicians. We find ourselves in very strange times with our industry very much closed. Our hope with these sessions was to bring us all back together to brainstorm and discuss. Our trade organisations more now than ever need your support, and if you would like to know more about how to join the ABTT as a member, a link has now been put in the chat, or you can go and visit our website. We have a wide range of different memberships available and would wholeheartedly welcome your participation and support. I can't advocate enough that being a part of the ABTT has opened many doors, and I've joined a family, and it's been that platform that has allowed me to promote my cause on mental health. We also have a donate button in the drop-down menu on our website if you'd like to support the ABTT further so that we can carry on doing research and great work. So it just remains for me to say thank you very much for joining us today. We wish you very well. Look after yourself. If you do suffer with any kind of mental health condition, please do make sure that you seek help and support. There are links that Alicia has been painstakingly putting on the chat for you. I know how difficult it is firsthand, and I know how scary it is to make that phone call, but there are resources there for you. Please do not suffer in silence. We hope to see you all very soon. Hopefully not on, no, don't take this the wrong way, but hopefully not on Zoom. Hopefully out in a theatre somewhere in the near future. But thank you very much for coming today.